Hi, my name is Mariam. My student ID number is 473126. Today I will be demonstrating correct procedures for sanitization, disinfection, as well as the wrapping of medical instruments following the CPSA and IPAC guidelines. I will be washing my hands with some antibacterial soap, rubbing it into your hands, a little bit of water to lather it on your hands. Making sure that you're scrubbing for 15 to 20 seconds. Hand hygiene is important because it helps remove any potential contaminants on your hand. Proper hand hygiene before donning can help prevent the introduction of pathogens. I'll finish washing my hand and I'll be right back. Now I'll be performing proper PPE while you're donning. First, you want to put on your gown. Then you will grab these two and wrap it around and tie it on the side. Then you want to put on your mask. Make sure that both loops go around your ears. Make sure that's on the bridge of your nose and you're tightening it there and pulling it down underneath your chin. Then you want to perform hand hygiene again. I will do that off video. Now that hand hygiene is done again, then we could put on our gloves. Make sure that it's going over our gown like this. And like that it's like over. You just have to fix it until it's covering this. Just so that no contaminants can get onto your skin and harmful bacteria. Now I'll show you how to properly doff your PPE. First, you want to grab your non-dominant hand and peel this one and make sure that it's going inside out. Now you want to make sure that you're rotating it into a ball. For this one, you want to put your index finger and slide it right through the glove and making sure this goes around like that. Then you're going to dispose of it. Next, for your gown, you can undo the knots that you already made earlier. And I'm just shaking it out, making sure that you're not touching the outside of the glove. Okay. Now you can just pull all of it, throw it into a ball, and throw it into your biohazardous. Now we want to perform hand hygiene again before we take off our mask. After the hand hygiene is done, then we can remove our mask, making sure that we only take this mask out right after we leave the contaminated area. So you want to grab it from here and just pull, and you can throw it out into your biohazardous waste. Okay, for this demonstration, I will be using a knife, fork, and a spoon to represent different categories of reusable medical instruments. Instruments classified as critical require sterilization, while semi-critical instruments require a high-level disinfection. If you understand the difference between different instruments, it ensures the proper cleaning process to prevent patient infections. Okay, for these instruments, the reason why I chose these is because this is equivalent to a scalpel, so it requires sterilization. Our spoon is semi-critical, which is equivalent to a dental mirror, which requires a high-level disinfection. And our fork is equivalent to a hemostat, which requires sterilization. Okay, now for this process, I already have my cleaner and warm water in the sink, as you can see here. I will be using a brush. This is one of the cleaning brushes that I have at home, and we will just be scrubbing off any of the visible debris as well as organic matter. I am using this cleaner. It is to break down biological matter, reducing microbial load before disinfection. Proper scrubbing ensures that all instruments surfaces are thoroughly cleaned. Okay, and we'll just do that. Now that we're all done, we'll be performing hand hygiene before moving into disinfection. Now I'll be performing the disinfection process using a higher level disinfectant. This is effective against any pathogens that are on the instruments, and according to CPSC guidelines, semi-critical instruments require at least intermediate level disinfection, while critical instruments will proceed sterilization. So now as we clean these, and then after we clean all of them and remove all the visible debris, we'll be rinsing it under warm water and placing it into our drying rack. Okay, and after our disinfection sterilization, we will now be moving on to our drying and storage in the clean area. So after these are thoroughly cleaned, I will be using a lint-free cloth to dry each instrument properly. But for right now, I will just be using a paper towel because it serves the same purpose. So then, after I dry them, you can either dry them with a lint-free cloth, or you can put it on a drying rack and move it into the clean storage area so it can be used the next time. For auto-cleaning process, before we do so, you want to make sure that you have a clean surface so we can have a proper cleaning of your area. So for right now, I'll just be using a paper towel and getting that wet and putting in any disinfectant. So I already sprayed my counter beforehand, but we will just be wiping down the counter so we prevent any bacteria that is on the counter. Make sure that goes in the garbage. Now I'll be showing you the process of autoclaving your items. So first, we'll be putting these. Now I will be showing you how to autoclave your instruments and they can go into your autoclaving machine. So first, when you put this instrument at an angle, you want to make sure that your instruments are dry before putting in here. First, you want to flip the corner and you want to fold, and fold again. Then you can have both of these two parts in and fold, fold. And the reason why you have to do so many folds is to make sure that no air or anything is getting into this instrument, so it can do a proper cleanse in the machine. Then when you're done all of these, then you grab your tape and you just wrap around. Let me open this and I'll be right back. So once you have, then you can wrap it, and you wanna, and after you wrap your item with the tape, you wanna make sure you label the instrument as well as the date and time and your name on it. And then next you're gonna just place it into the autoclave machine like so, and you're gonna just close it and turn it on. So after we finish our autoclaving all 3 items and we put them in the autoclave machine, we want to make sure that we are wiping down our station again. So just like how I did it earlier, we'll be doing it all again, and as well as performing hand hygiene, which is important because we were just dealing with clean contaminated items, but we were still in a contaminated area. So this does conclude my demonstration of sanitization, disinfection, and wrapping medical instruments following CPSA IPAC guidelines, and as well as showing proper procedures for donning and doffing. Each step ensures proper infection control and patient safety. Thank you for watching.